Within 5 years of starting dentistry, over 80% of the dentists actually show signs of back pain or neck pain or some form of musculoskeletal pain, and it can lead to like days off and problems.
Are there some things that you would say, okay, immediately stop doing these following things because they're being detrimental to your health or to your back?
As I know you're only dentists and you sit in chairs, but if you approach it more like an athlete would approach it, if you train hard before you get to your dentist chair, you're going to have a much higher chance of not getting the back pain.
How do you actually make time for yourself? What can actually fit into your routine? What kind of stretches, based on your experience and what you guys do with itching, would be good stretches for dentists to easily do maybe between patients at lunch break to help them with their back health?
80-90% of the pains that you guys will get is from a repetitive strain from sitting too much and being weak in the first place.
All making time is making something a priority.
You need to get into the right mindset and actually prioritize your own health.
Back-to-back non-clinical episode, but these are important topics. Last week, we talked about a very tough topic of suicide, and Professor John Gibson, wow, what a man, right? So if you haven't heard that one, please go back an episode and listen to that Interference Cast. Interference Cast, by the way, are our non-clinical episodes. And more we get as much love for those ones as we do for the clinical ones. And it's quite rare that we do like two non-clinical ones back to back, because the pillar of Protrusive Podcast is making dentistry tangible and all that clinical geeky stuff that we love. And I promise you, I've got some great episodes about zirconia implants and injection molding, how to make sure you don't do a messy job. I've got all that coming up soon. But you know what? I make no apology for the fact that this month we're dedicating on the app to stress, pressure and burnout, and therefore there'll be a few more Interference Casts this month. Last week was mental health and suicide prevention. Today is health, longevity, exercise, diet, all those things that are so crucial to us. Hello, Protrusive, I'm Jazz Lati, and welcome back to your favorite dental podcast. I've got Fraser Smith today, who he's not my personal trainer. We do like one session a week, and it's in this EMS clinic whereby they basically zap my muscles as I'm working out. It's like a 20-minute workout, but that 20-minute workout is as effective as a 40-minute workout. So it's very popular with time-poor individuals like me, and I really enjoy it. And so I've never had a personal trainer, but like Fraser's the closest thing I've ever had to one. And what I love about him is that it's been great to get to know him over the past 6 months and talk about health and wellness and longevity and supplements and diet and all these things. He's a very clever guy. He's got a master's degree. And if you look at him, he is the pinnacle of health and fitness. It reminds me of, and I think I've mentioned this far too many times in this podcast, but when Cristiano Ronaldo rejoined Manchester United, and what happened in the canteen is that everyone was looking at Cristiano Ronaldo's plate. What was Cristiano eating? And so in the same vein, look at this really healthy chap, really intelligent. What does he believe in? I'd love to know what he believes in. And I did ask him all those questions, and specifically I wanted him to share with us what he thinks we should be doing as a population of dentists to look after ourselves more so we have a longer career should you want one. I mean, there's one thing not being able to work because you are not healthy, because you are in poor health and maybe you got too many strains and you can't work so much because you have neck or back problems. That's one thing. But there's another thing where you stop working on your own terms. So we should all eventually retire on our own terms and not because of health. And more in healthcare, it's not so much about how long we're going to live, but how many quality years we're going to live for. And so for me, one of my highest values is your health. Health is wealth, an old cliche, but I truly believe that. And I, over the years, have gone down this rabbit hole of looking after my personal health. It's one of the 3 rabbit holes we should all go down. One is your trade. So we should be geeky about our dentistry. We should go deep into our profession and all the clinical nuances because we owe it to our patients. The second one is personal finances and learning about how to manage money and what money actually is. And there's plenty of episodes. I did one about personal finances a few episodes ago. Check it out. And this one is health. We all should go down a deep dive into health. I know in my career that sometimes when there's too much pressure, there's too much stress, that one of the first things I sacrifice alongside sleep is exercise. And I feel as though a lot of dentists, we can relate to that. And I really never want that to ever happen to me again. And so I'll tell you what I do. Before, I used to think that if I can't hit the gym for a full 50 minutes, 1 hour workout, then there's no point. And I'd rather just not go. If I can't do it properly as I used to think, then there's no point of me even going. But what I started to do was I started to do half-an-hour workouts. I made peace with the fact that I can go in, I'm gonna do like drop sets and be a bit more intense, but all I can do is half an hour. But you know what? I can do it 4 to 5 times a week, and it's just half an hour. And that fits into my lifestyle so much better, and I'm so much healthier and better for it. So this episode will talk about that kind of mindset and how much exercise do we need, what is the best type of diet or nutrition to be on, and how to really stay injury-free as a dentist. So I hope you enjoy this episode. If you're on the app right now, interacting with all the themes of pressure, stress, and burnout, thank you so much. I appreciate it. It's been great to do the weekly polls and get your insights. And in 2 days' time, I have a fantastic episode coming about compassion in dentistry. You don't miss that one. But for now, let's join Fraser Smith and go deep into this world of looking after yourself and your health. So we have Fraser Smith on the Protrusive podcast. Welcome, my friend. How are you?
I'm very well, thank you. How are you, Jazz?
Feeling absolutely excellent. Look, you guys at MyFitness are the closest things I've ever had to a personal trainer, right? I've never had a personal trainer, but when I'm with you guys, it's like 1-to-1, 1-to-2, and we're doing EMS. And like every time I have to explain to someone what EMS is, you're going to do a much better job than me. But essentially, I tell them I'm being electrocuted while I'm working out, and that gets a laugh and is good. But can you more scientifically and correctly explain what's happening when I'm doing an EMS session with you guys?
Yeah, certainly. So I'd say it probably stands for stimulation rather than being electrocuted as such. That's more of an execution. So yeah, the aim of EMS is electromuscle stimulation. So what you do is you're going to do a full functional workout for only 20 minutes. But during that workout, you're getting a stimulus directly into the muscles, which helps activate them. So if you do have, say, areas that are very stiff or areas that are in pain or areas that you just find are weak, it's a very good way to force the muscle to activate whilst being guided, as you said, by one of the trainers in a very functional way to target the goals that best fit your fitness needs.
The first thing I did when it came on my radar, because you guys are right where I work at the practice, and so when I saw your poster, the first thing I did is I went to like Gemini and ChatGPT. I said, okay, EMS, is it a fad or is there any science behind it? And I was pleased to say that, okay, we had some studies showing that, okay, it improves muscle mass and it's generally a good thing. However, one interesting thing was it's a good thing, but it should be as part of a general regime where you're doing not just EMS, you're doing other things as well, and weight training and cardio and everything. So when you're designing, let's say, if you put a personal trainer hat on, when you're trying to design workouts that can fit around someone's busy life, what kind of mix, like in an ideal world, how many days should someone work out and what kind of exercises should they do? For example, push-pull legs is a very popular thing that people try and do. For me, it's trying to go to the gym 4 or 5 times a week, one of which is an EMS, play football on a Tuesday night, a little bit injured from last night. But tell us what is ideal from your research. And actually, before we go there, let's talk about your credibility, right? Tell us about your journey into health and functional training. And let's talk about you and your journey, which will then help to inform this question I've asked you.
Yeah, sure. So I'll keep the stuff about me brief, but yeah, I did my sports science degree a very long time ago and then mastered in nutrition. And I was fortunate enough to work in Premier League and international football for about 5 or 6 years. Then in London, I've mentored lots of different trainers across lots of different gyms, trained all sorts of people from, 85-year-olds who are just trying to ensure they can walk through to elite level athletes and all the dentists in between. But we've done all of that. And then I've ended up opening my own studio just so that we can really focus on that health, wellness and longevity, hence how we met. And our main focus within that is to kind of give people that structured approach to their weekly training. So that's brief about me. But then in terms of what you asked, it's a very broad question being, what can people really realistically achieve? So if you give an absolute optimal, most people are so far off it, they'll just shut down and switch off. For some people, you mentioned EMS, that might be the only thing they do, and they will get good health benefits. They'll feel better, they'll move better, they'll have less pain, they'll feel a lot healthier in their day-to-day. But then you're probably, in a good way, you're at the other end of the spectrum where you do have a wider balance. So you need to think of the different pillars of health. You've got to get the training right. So by that, it means, are you strong enough for your day-to-day function? And then in, say, dentistry, are you actually strong enough for your profession? Are you fit enough for that? Then you need to think about all the other factors as well. Like, do you have individual goals? You do individual events. Say for you then also need to be fit for football. So you would need a combination of your strength training, your endurance training. You'd need some form of mobility and health, like a reform of Pilates or yoga. And then, yes, you'd have the EMS for your functional intensity. So without being too vague, it really depends on the individual, but you need to work out what are your goals and how realistic it is that you can train in order to get to those goals and how much time you will therefore need to commit.
So let's imagine there's a dentist right now listening. Her name is Tracy. She's 39. She's got 2 kids, 7 and 3. And she's a full-time practicing dentist, 5 days a week, the odd Saturday here and there maybe. She's busy, right? She's a busy girl, 2 kids. Life is tough. Right, this is like it's a beautiful time because you got the kids and the young family and all the magic of that. But you're also trying to build a career and maybe investing in a practice. And very often when we talk about health, I get a lot of dentists messaging me on Instagram and stuff saying, "Hey, you know what? I'm glad you put that out there." Because I realized how I've neglected my body, right? And so where I come from, and when I think about wealth, right, Fraser, your physical health is a pillar of wealth. There's 5 pillars of wealth. One of it, you can't be wealthy without having spirituality. You can't be wealthy without having good family support or just having good relationships, right? So health comes into very much into that domain. Now, for that made up imaginary scenario, which will actually resonate with so many people listening and watching today, what's the first thing that you would tell this specific individual in terms of, okay, how do you actually make time for yourself? What can actually fit into your routine? And how would you start, considering you're probably quite sedentary, working on a dental chair, hunched over? What is the ideal regimen for this described scenario?
Yeah, I think you've nailed it by saying that it is one of the pillars of health. I think we often prioritize the wrong things. So first of all, you need to get into the right mindset and actually prioritize your own health. Because say Tracy, for example, will prioritize all the clients that she sees. She'll prioritize her kids, probably her family as well. So it's about actually thinking, you know what, I do need to force in some me time. So just build up gradual and often. So for someone like her, you'd need to think, okay, can I at least do once a week? I've been sedentary for X years. Can I try and do something once a week? And that might just be 20, 30 minutes. It might be like you do, where you come and do a 20-minute EMS session, but it might be that you just do something at home where you do, 10, 15 minutes of stretching and then 10, 15 minutes of some body weight work and just gradually build it up. And I think if you look at, say, where you've managed to achieve, where you're doing 4, 5, maybe even 6 activities in a week, that'd be too overwhelming and unrealistic for some. So you've got to start by getting the right mindset that you need to have a little bit of you time, and then also realize that you don't need to do loads in order to get good progression.
Now, considering it's a dental podcast and we are all dental professionals, we are hunched over, quite like the office worker as well, on their laptop, the poor neck posture, backache, all that kind of stuff. One question I have for you is deadlifts, specifically about deadlifts, right? Because deadlifts, a lot of dentists worry about doing deadlifts because, what if I injure my back and then I'm out of work for a week or more? So, however, I've also heard that actually for dentists, deadlifts are a very good thing to strengthen your core and your back and therefore keep you injury free. So what is your understanding of deadlifts and how it may fit into a dental professional's life and exercise regime?
Sure. That is a very specific question about a specific exercise. But yeah, happy to help on that one. No, deadlifts are a brilliant exercise, but you need to do them right because there's an element of technicality to them that is probably in excess of lots of different exercises that would be much easier to start with. So yeah, with a deadlift, it's a great all-round exercise because you generally lift relative to the individual a large amount of weight. So there's a lot of load going through the whole system. And due to the nature of the lift, nearly every single joint and muscle group has to be involved in some capacity. Now, like you said, the injury risk will put some off because if you go to any gym, you could see some very bad looking deadlifts where they're loading the body in completely the wrong way. And that will put you at risk. So again, it always goes back to make sure you can get like the right technique and get some guidance on that, but just start sensibly and build it up. So in short, it is a great exercise, but you need to know what you're doing with it. And again, it is in isolation, as I will answer your question, but just the deadlift would obviously be far too simplistic in terms of an overall regime for what would keep a dentist fit.
I just wanted to myth bust that particular thing. Now, when it comes to keeping a dentist fit and actually moving beyond a deadlift, things that us dentists speak about is Pilates. We always say that, we've heard that, okay, we've got to be doing Pilates. So if you had to prescribe one, like for Tracy, if she had to do one thing, like you said, okay, do something basic at home, maybe some stretches and stuff. But if there was one thing that she could actually go to a gym or a place like yours, by Fitness, and do some sort of activity, would it be Pilates for someone like Tracy?
It would definitely be high on the list. As a caveat is I'm obviously highly biased here. My studios, we offer like assisted stretch and sports therapy. We offer the Reformer Pilates and the EMS, which you've mentioned. So yes, I'm a big fan of all of them. If you've got time to commit to a big gym routine, great. But if you haven't, something like Reformer Pilates is a very sensible balance because you mentioned about The deadlift, that's a bit more technical, requires a bit more equipment. If you're willing to go to Pilates or a form of Pilates, whether it's in a class or you get one-to-one, it's a very good way to balance the body, especially for dentists who do get stiff in all those areas you mentioned. It's a really nice way to just free them up and gently strengthen them. So it's a nice base starting point to build up from. But similarly, there's the other caveat. If you do go to these big groups where there's 20, 30 people, just be careful that you have a rough idea of what you're doing, because they can range massively in terms of the way the session's taught. So you need to be careful on that side. But again, give them a go. But yes, in short, reformer is a great way to keep yourself fit.
And one thing we hear about all the time is doing stretches. Now, there's a famous poster in the dental world, right? It's by the British Dental Association. And like virtually every dental practice you walk into, you open a cupboard to get a file or something, right? And then you see this this poster, and it's basically stretches to do in between your patients, right? Because back pain is like a serious thing, and so there's these stretches. What kind of stretches, based on your experience and what you guys do with assisted stretching, would be good stretches for dentists to do, to easily do maybe between patients at lunch break to help them with their back health?
Yeah, that's fair. I'd say stretching is a good acute fix in terms of it will give you a bit of alleviation from the pain that you might be suffering. But then that's the temporary, and then that's when you'd add in the reformer. So I'd probably even swap them over. You stretch, like you say, day to day, and then you do the reformer to prevent it coming back. But it really depends on the individuals. The key issues with dentistry, which you'll know about, is that within 5 years of starting dentistry, over 80% of the dentists actually show signs of back pain or neck pain or some form of musculoskeletal pain, and it can lead to like days off and problems. So it happens very, very quickly within dentistry. So in terms of the actual stretching to do, if you want like a whole body approach, you need to do something that targets like thoracic mobility, as in like the upper spine, because as you mentioned, you're hunched over all the time. So your body's in this stiff position. So you need to do spinal extension, spinal flexion. Then one of the key things, if you think of the spine like a fishing rod, is higher up the spine you go, the more flex it has, and towards the base it's stable. Keeping that in mind, that means you need to add in a lot more rotational work in the upper body as well. Same with the shoulders, and then same with the neck. You've got rotation, you've got the flexion, extension. So you need to basically counteract what you're doing. So as a dentist, you're hunched forward, your neck's up a little bit, and you shrug. So you basically need to reverse all that. So you need to extend up through the spine, rotate it a little bit. Same with the shoulders, let them relax down. You can roll them around, just get them moving, get more blood flow into the muscles. And then same with the neck. You want to do some retractions, some rotations, some tilts, all those kind of basics, just to promote blood flow into the area, make sure you've still got that movement capacity. And there's a little bit of a myth as well to add that when people get tension and pain, it's often because of a weakness rather than the overuse per se. So your muscle might feel tight and you think, oh, I've overused that muscle, I need to stop. Whereas actually sometimes moving it is the best form of medicine you can, because it'll just promote the blood flow to that area. And so for dentistry, I'd say it's more in those regions. So the upper spine, the shoulders and the neck, get them moving, get them mobile. The lower body tends to be okay in dentist, and then lower back pain, you could go into a whole range of stretching there. But in short, I'd say focus more on the upper pains where you get them.
Well, we talked a little bit about, things to do, like Pilates, being fit and active. Motion is lotion, to getting movement in. That's good. Are there some things that you would say, immediately stop doing these following things because they're being detrimental to your health or to your back?
Potentially. It does depend on the individuals, but I think from understanding the dentistry side, it tends to be the more people you see, the more hours you work, the greater the correlation it is to having issues. So I'd say things to stop doing immediately would be not taking breaks, not doing the stretching that you mentioned, not having strength, avoiding sleep because you're just too busy. If you're doing that, you're going to win in the short term. You might think, oh, I've seen lots of patients this week, happy days, but you're going to have a shortened career. And as I've seen statistically, a lot of dentists stop their careers because of pain rather than the fact that they wanted to stop. So I think you need to kind of invest at the start in your health and wellness in order to have a longer, happier and pain-free career.
Hello, YouTube Protrusive. I know you're watching on YouTube and I hope you're enjoying this episode so far. But I wanted to highlight, in case you don't know yet, we have an amazing viewing experience on protrusive.app, our website, our network, our platform. So I just want to spend a minute to show you what this looks like. On the left side, you see the navigation, and when you join the app, you get a 1-minute video tour of the entire network. Now, in terms of where the magic happens, that's in the Protrusive community, because you might come for the content, but you'll stay for the community of the nicest and geekiest dentists in the world. We have all these polls, we have a chat group, there's always active chats and dentists helping dentists. And really what I want to do is create a really supportive environment that's not like the environment we have on Facebook, and it's built on the values of niceness and geekiness. If you are nice and geeky, you belong here. Now, to make this a safe space, we have a manual process of approval. We actually verify that you are a dental professional before you get in here. So we have hundreds of applicants a day. So if it's been about 2 days and you haven't heard anything, either something's in your junk or you need to reach out. If you're still waiting to join your tribe, email marie@protrusive.co.uk. That's MARI@protrusive.co.uk, and she'll investigate what's happened. Now, all the videos you have on YouTube are also on here, but you actually have some extra ones for free that you don't have on YouTube. So you get some bonus content that's not on YouTube. And actually for the future, I'm not taking things out of YouTube, but some things are not appropriate for the wider public, and I want to sort of safeguard that information, which is like dentist talk, if you like. So that's why a lot of the content is only here and not on YouTube. So you're kind of missing out if you're not on here. That's why I'd love for you to join there. And if you join one of our paid plans, then what you get is access to the CE quiz, like this one, and you can get CPD or CE certificates, and also you get our premium notes. So these are a great aid memoir or revision for an episode to really cement your learning. And whilst we have ads and YouTube places ads on YouTube, we don't have that on our network. So for the paid plan, you get to see all of the premium notes without any of the ads. And of course, you get to support Team Protrusive and help us to continue what we're doing. I'm just going to gloss over the Protrusive Vault, which has all our infographics and downloadables. These are all our masterclasses at this moment in time, and we're always planning to add more. And if you look at them, there's about 1, 2, 3, it's about 7 of them. But actually, if you look at the replay section, some of the live masterclasses that I've done and some of the training that people pay for on other websites is all on there, included as part of the masterclass subscription. And if you're a student, don't fear, we have a special section for you with all the student notes, which anyone can access. So for example, here is one on exodontia. So it's all there waiting for you on Protrusive guidance. Please head over to the website, which is protrusive.app. Make an account on your browser. This could be Safari, Chrome, however you want to do it. And once you've made your login, then you can download the iOS or Android app and then log in through there. So the reason to make the subscription primarily on the website first is that you get access to a free trial, which you don't get if you do make an account on Android, iOS. If you make it on the website, you get access to the free trial, and you get our best price if you sign up through protrusive.app. So our best deals and free trials are only on protrusive.app. Of course, we always put the link below in the description, and thank you so much for enjoying our videos on YouTube. But it's now finally time to level up your experience. Back to the episode. One thing I really want to geek out with you about, and we had this lovely interaction a few weeks ago when you were covering for Jazz, and then on the EMS session, we just like, as I was working out, being electrocuted, we were talking, stimulated.
There we
But
go.
you were talking, we were talking about nutrition, right? And so I was really interested in hearing, because you got this, when you said you had a nutrition, it's an MSc, right?
Yes, correct. Yeah.
So nutrition MSc. So I was immediately thinking, okay, well, this is the guy to ask about supplementation. So I told you my stack of supplements, and then you told me yours. And since I took away from that was I've now added HMB. So my next monthly Amazon subscribe and save will get some HMB as well. So HMB, guys, by the way, is what Fraser taught me. It helps to prevent muscle breakdown, right? Which I like the idea of that, and correct me if I'm saying anything wrong here, Fraser, but I like the idea of that because I like to do intermittent fasting from time to time. So I do think about, not feeding myself and then not being in the state of anabolism because I'm not eating, and therefore stopping my muscles from breaking down. It's like, I like the idea of that. But tell us more about that one specifically before I then take a bigger picture about nutrition.
Sure. HMB is often used clinically if someone's bedbound. They give them HMB and it'll stop the muscle wastage. So like you mentioned, if you're doing intermittent fasting or you're having really heavy periods where you're not sleeping right, you're not eating right, that kind of thing, you could add in HMB. That would lead into another one and say creatine. It's probably the largest studied supplement of them all, and it shows to be very positive. Some people worry about the kidneys, but there's not really a lot of data on that unless you actually do have kidney issues in the first place. So if you're taking kind of gentle amounts of creatine, let's call it, then you're more likely to increase your muscle strength because you're going to increase the protein synthesis, and it also can add a little bit of energy to the muscles. It'll work a lot better if you're doing training alongside it as well, because the body tends to respond better to the creatine if you do that. Then in terms of general supplements...
Just on creatine, Fraser, before we go to general supplements, because you mentioned creatine, in our dental circles, when I've spoken to, like, I used to work with this wonderful nurse called dental nurse called Marie in Reading, and she had this phase of taking some creatine, and she hated how much weight she'd gained because obviously all that water absorption, right? Like she hated that, and like she started to feel like muscly and chunky when using her own words, and so that actually puts a lot of people off. So what do you think about? And it's usually ladies that have told me that. What do you think about women taking creatine and then feeling all like, I don't know, muscly or that kind of feedback? I don't know if you hear that often.
Yeah, I think it's not. I wouldn't say it's as far as a myth, but it's not that dramatic. Like you will have a slight increased water retention, which actually helps to increase the function of the cells. Because as you get dehydrated, the cells don't function as well, and as a result, we won't function as well. So it's not quite a myth, but it's not that big a thing normally for most people. And also, you're not needing to take creatine indefinitely. It's like just add it into the diet if you think you're low on, well, food sources that give you creatine. So if you don't eat meat, for example, it is harder to get it in. If you eat lots of meat, you're probably going to get sufficient amounts anyway. And so I think it's a little bit, people go all or nothing with all of these. That's the risk when you give advice on supplements, because people go a bit too hardcore. As well as being deficient in something, you can be toxic in something. So you just need to, get the balance on all of these things. And then in terms of general nutrition, I'd say that's where you really want to focus. So supplements are exactly what they say. They supplement, like they're an extra to what you do. And there's none of them are magic. But the top ones, I'd say, are vitamin D, your omegas if you're not accessing them, the creatine, and H&B, like you mentioned, during times of fasting, etc. But then you'd really just need to focus on the diet, and that's about just eating a well-balanced diet. You could go into that for hours, but I think most people understand roughly what they need, but they also understand that they don't eat as well as they should.
There's so many different directions we can talk about nutrition over the next minute or so. So part of me just wants to know, well, Fraser, what's your diet look like, right? It's a bit like what it reminds me of is when Cristiano Ronaldo rejoined Manchester United, right? Everyone was like looking at his plate. Okay, what does Cristiano eat, right? And they're kind of like copying him. So with your MSc in nutrition, tell us about your diet. And I'm just going to add a little bit more context to that, because we live in a very polarized world in terms of the information. If you go on social media, and depending on which algorithm you get, like veganism is like really, really, really pushed. And I'm all for it for environmental reasons. I'm not a vegan, but I understand that. But at the same time, carnivorism, like carnivores, okay? And then they are really pushing that actually, you know what, this is the best diet. This is how we're meant to be. And all these health benefits and ketosis and all that kind of stuff. Even like Jordan Peterson and his daughter have gone carnivore. So sometimes I look at really clever people and I think, okay, what are they doing, right? Because they're doing something that there's got to be a reason for that. So in this world, we have two polar opposites, veganism, carnivorism, and virtually everything in between. What is your nutritious religion, if you like? What is your philosophy that you follow personally?
Yeah, I think that's fair. I'd sit in the middle, just because I tend to think of things in moderation. I think, as you say, the internet's far too polarizing. That could be a whole podcast in itself. But I think when it comes to nutrition, it's just about getting a rough balance. Like personally, I'm not going to live like a monk in terms of I will enjoy a night out from time to time. I will enjoy a good meal. If it's my birthday, sure, I'll have a birthday cake, that kind of thing. I've never been the guy to weigh out to the exact gram your protein intake or your amount of rice you eat. I think especially the longer you're in the industry, you realize how unhealthy that becomes. I think what you need to do is have a base understanding of nutrition and what macronutrients you need, micronutrients. You've got a rough understanding of how much protein, how many carbs and fats I should be having, and then eat in and around that. And then you can use common sense. Like if you suddenly found yourself highly overweight, then sure, you're going to have to be disciplined and reduce what you eat and eat better foods for a while. But if you are of healthy weight, then you're probably going to get away with the odd, pint of beer, for example, or piece of chocolate cake. And then if you're undernourished, you need to work out, okay, how can I increase this? So I think going polarized in any direction gets a bit too extreme, unless you go to that elite level athlete where they're looking for that 0.1% difference to win or lose. Then that's where you see more extreme approaches happen. But in short, just try and find the right balance that allows you to have a healthy lifestyle, but also enjoy yourself. Because you've got to think of the psychology of it as well. Most people really struggle with diets and they'll just be miserable day after day. So you need to try and find that sweet spot of discipline versus enjoyment.
Yeah, life is to be enjoyed as well. So it's definitely got to be a balance. One thing for sure though is eye-openingly, I was always thinking, I thought I'm eating well, but then one of my good friends, Mahmood, he said that, Jazz, you're probably not getting enough protein for what your goals are and how many workouts you do, and you're probably short on that. And I really thought about it, and I thought that, you know what, maybe I'm not getting enough protein in. And I think that's a common one for someone who's got some fitness goals and they're hitting the gym a lot. Then they need to get a certain amount of protein in. Any advice of getting the right amount of protein in? Because you know what, Yes, I do have the whey protein and the time to time, but I don't like depending on that. So what tips would you give to for general public really for getting more sources of protein?
Yeah, no, that's also a huge debate in the industry as well. Some people advocate taking 2+ grams of protein per kilo of body mass every single day, even higher if you're weight training, etc. Some people on the health advocacy say you don't need more than like zero point 0.8 to 1.2 grams per kilo. So again, that's where you might do a little micro analysis of yourself and just track it for a week. I wouldn't do tracking indefinitely. It gets boring, also gets a bit tedious, and it's not healthy for a lot of people, just to caveat that. But I would do that to get a base understanding. And I personally, if you're falling anywhere from 1 gram to 1.4 grams of protein per kilo per day, and you're talking about if you're out of healthy weight, you're going to get more than enough protein in. Now, how you get there really depends. If you are carnivorous, like you mentioned, you're going to get it very easily, because if you're having like a chicken breast, you're probably talking anywhere from 20 to 30 grams all in one go, no problem. If you have a steak, same thing, maybe even higher. If you're vegetarian, it starts to get harder. If you're vegan, it gets really, really hard. So what you need to do, you need to identify within your bracket of where you sit on that spectrum we talked about, what foods are high in protein, and then try and start adding them in regularly. And then, like you mentioned, use the supplement, as it's called, from time to time, but don't rely on it. So whey protein, casein, or pea protein, whatever one you want to go for, it's a nice way to top up, but I wouldn't rely on it. And then within that, check the source, because there's a lot that have all sorts of chemicals added in. If you think about processing, they can be highly processed products. So you need to try and find one that's clean. For me, it's very easy. I can eat meat. I could take a whey protein, easy. If you're a vegan, you need to really think carefully. Like, they might move to tofu or legumes, and then they might have to find a pea protein and that kind of stuff. So it's definitely a lot harder, but it's very doable. So yeah, the amount of effort you put in depends where you are on that spectrum.
Thank you. And I'm just going to go pivot back to general health, physique, posture, and pain. When someone's having a pain, I got like a tight back, tight neck, and like for me, I've got a bit more of an acute injury now at the top of my calf, the back of it. So I know I can't load that leg. I'm kind of limping at the moment, so I wouldn't do anything stupid. I need rest. But for that general stiffness and general back pain, you said already, like, how movement is good and perhaps walking is good and stuff. What advice would you give to someone in terms of, okay, well, I've got this back pain. I don't know whether I should be active or not. So what general advice would you give to dentists who may be feeling a little bit stiff? Should they just go for it and they'll get better? Or should they avoid certain types of exercises? Generally, how to know to build up your intensity, I guess.
Yeah, that's fair. I will pivot back slightly just based on, I will answer that, but I'll pivot back to when you mentioned about Ronaldo. The key way is to try and prevent yourself getting it. As I know you're only dentists and you sit in chairs, but if you approach it more like an athlete would approach it, if you train hard before you get to your dentist chair as such, you're going to have a much higher chance of not getting the back pain in the first place or the neck pain in the first place. Because if you strength train, whether it be reformer, EMS, gym, whatever it is you choose to do, you're going to increase your muscle strength, your tendon strength, you're going to increase your endurance. So you're less likely to ever reach that threshold that then becomes repetitive to the point where you start hurting yourself and overloading all these joints. So that's what I'd say is the first advice, is try not to get it in the first place by preparing. Then if you do get it, yes, you need to apply a little bit of common sense in terms of the severity. Now, you're talking, 80, 90% of the pains that you guys will get is from a repetitive strain, from sitting too much and being weak in the first place. So the way you approach it is unlikely to need an MRI scan to see if you've slipped discs and all that kind of stuff. However, if pain is severe enough, don't get me wrong, you need to approach medically. If it's not, though, the general first approach would be, as you said, the motion is lotion. So you want to do some general stretching, start mobilizing all these joints that we talked about earlier. And then it's about gently strengthening up. So you just need to build it up slowly and start using these muscles. And what you'll actually find is if you do gentle activity and build it up sensibly, you'll realize that the pain you have will actually start to subside. And you'll find that there's certain activities you can do that don't trigger the pain. So you can actually work kind of around the pain or with the pain. So there's different ways to do that. But the worst thing you can do is, as you kind of touched on, is almost just ignore the pain and just hope that, oh, maybe if I rest, it'll go away. But the probability is that you've got the pain because you're in such a tense position for so long. So by resting, you're probably going to stay quite tense unless you're allowed, 2 weeks in the Maldives, for example, then it might calm down a bit. So yeah, so try and stop it happening. And then also just gently start moving and building it up and getting adequate sleep, hydration. So proactively attack it rather than just back off and hope that it gets better.
When it comes to pain, anything that's been lingering for 3 months or definitely more than 6 months, it enters this very interesting territory of chronic pain, this idea of chronicity. And really, we want to help. We want to make sure that we don't allow our pain to become chronic, because then there's different nerve signals. Even though the source of the source of the problem is gone, the nerve signals are still firing to continue the pain on. It becomes more resistant to treatment when you have chronic pain. So getting in early, prevention. And so I agree with you in terms of getting in early and making sure that you don't let it live with that pain without actually doing anything about it for long and long, because it can get more chronic. Any insight you can give on working with athletes and working with people who may have had chronic pain?
Yeah, I mean, as we touched on, you try to stop it becoming chronic. I think a common problem within dentistry, and this is a lot of professions, is that when you first get a pain, we tend to ignore it. So try and strike early, because that's the only way it becomes chronic, is if you're like, oh, I felt my shoulder today, never mind. And then you feel it again next week. Then suddenly it becomes every few days, then it's every day, then it's constant. So the thing is, try and be proactive as early as possible. Like you said, if you can train beforehand, then you won't get the pain. If you end up getting or feeling a pain, make sure you do something about it quickly. When it does eventually become chronic, if you've sadly got to that stage, then it is about managing it out. And it might be a combination of just working physically, but also then you might need a little bit of clinical intervention depending on how bad it is. But sometimes, like you said, dampening the pain signals, maybe that's with painkillers, if you can take those things, then it'll actually give you a window of opportunity to start mobilizing it, start strengthening it and moving better, and then it won't come back. So just that healthy balance. But yeah, chronic pain you do need to manage out. Like I said, you're always like repetitive strain, because you're doing the same thing again over and over. So the key is actually moving all those muscles and those joints in a slightly different way. And that's where all these different forms of exercise come in, because you're going to move in within the realm of the pain, but in ways that the body actually really enjoys and starts to calm down. And over time, you'll find that pain just starts disappearing, because your body's realized that the pain trigger's kind of gone now, and the phantom pain will start to die down. If the longer the chronic pain is, you can almost get a phantom pain. I think you touched on it. Even though you're cured or you're healed, the body's so used to giving you a pain signal that it's still there.
Yeah, that's a big one. And I help patients with the temporomandibular disorders, umbrella term. And that's something that we always worry about, the chronicity of pain. Look, Fraser, you've answered all my main questions I had for you. This is an opportunity for you. Firstly, just say any addendums, anything that you wanted to add in terms in the context of either nutrition or pain prevention or health and longevity, specifically for dentists, that you've been thinking about since we agreed to talk about this podcast.
Yeah, sure. I'd say it's probably all, summarizing what we said, really. It's, one or two busy weeks shouldn't define your whole career. So you want to really prepare for the dentistry that's to come. So try and look after the body early. I'd even suggest, say, you do a 5-year course, right, in dentistry, is it normally to get there?
Yep, that's right.
Within that 5-year course, I think dentists should be already physically training. Like, understand that it's really important to have a baseline health, a baseline fitness, and that includes your general strength, your cardiovascular health, the endurance, your mobility, range of motion, so that when you actually come to doing your practice, you're not really or very unlikely to hit those thresholds that trigger the pain or trigger the problems. And then, within your industry, just make sure that you put aside time for yourself, whether you're the Tracy with 2 kids dentist or whether you're any other form of dentist. And I think that's the most important thing, like seeing it as part of your profession to stay healthy, because then you're likely to have a happier and healthier career, to not sound too cheesy. So it's the old, fail to prepare and prepare to fail.
Making time, all making time is making something a priority. I always say
Exactly.
It's about making something a priority rather than making time for it. By not making time for it, you're saying that, okay, all those other things in my life are more important. And the thing that I'm saying more recently, because every month we have a theme on our little community, and this month actually, at the time of recording, is personal finances and stuff. And I say that, look, yes, it's good to have financial success and thriving practices and stuff, but if it comes at the expense of your health, that's not wealth at all. And then we've said that already in this podcast. Fraser, please tell us about where it is that you work and which chains you have. I'd love to promote what you do. I know obviously you're in a London area and our listeners around the world may not be able to access you, but you maybe inspire them to find their local center, or they might do EMS, or those of us in London can come and check you out as well.
Yeah, thank you. So we Vive Fitness. We operate in London. We have studios in Westminster, Mayfair, and in Richmond. And our main focus really is targeting health, longevity, and wellness. We're not about the kind of the hardcore fitness where you got neon lights flashing with heavy music. It is more kind of abiding to a dentist, where you can come in and just someone can give you a sports massage or a stretch session so that you feel a lot healthier. Then you've got that window of opportunity to do either your reformer or your electromuscle stimulation. and that'll just gently strengthen and improve your overall health. And hopefully Jazz can attest to this, that you just do feel healthier and better for your day-to-day function on that.
No, that's absolutely brilliant. I'll put the website for everyone. And Fraser, I appreciate your expertise and time to help us be just living healthier lives. And I really appreciate your time today.
Thank you, Jazz. It's great to be here.
There we have it, guys. Thank you so much for listening to this episode with Fraser Smith all the way to the end. Honestly, when you guys make it to the end and you hear this part, it really means a lot. You are someone who is serious about finishing what they started, and that is becoming rarer and rarer nowadays, so I congratulate you. Thank you for choosing this episode to go all the way to the end. There is no CPD for this episode. There just wasn't enough juice for it to be CPD, but I'm hoping it was valuable for you still nonetheless. But of course, 98% of our episodes are eligible for CPD and CE credits, and we are a PACE-approved education provider. If you'd like to talk more about this kind of stuff with a community of dentists that is nothing like what you see in the toxic world of Facebook groups, it's our community. It's Protrusive Guidance. It's not easy to get in because we kind of need you to prove that you are a dentist before you come in. But once you're in, honestly, it's the nicest dentist in the world, and we all play nice. I've never had to ban anyone, and it is thriving and growing, and our team is just in love with what we have all built together. So if you're the kind of person who's listened to the end of this episode, you need to be on Protrusive Guidance. Go on the App Store or Android Store and download Protrusive Guidance, or the best way is to make an account on the web. So head over to protrusive.app on the web browser, make your account, and then those credentials you can use on Android and iOS. So we'll see you on Protrusive Guidance, home of the nicest and geekiest dentist in the world. And I'll catch you same time, same place next week. Bye for now.